Deputy Kenny.
Thank you, Chair. Thanks for each of the group's submissions. They were very, very insightful, and it's a very topical issue in relation to what's happened in the last 4 months in relation to the public health emergency. And I think we've had a juxtaposition in relation to the amazing outpouring of solidarity, support by, people coming together, which sometimes it wouldn't normally happen like that because of society. But that juxtaposition of that coming together, and also, the other position of self-isolation and the isolation of the public health emergency, and that has been has taken a huge toll on a lot of people, and that's almost unquantifiable. And the unintended consequences of that will probably be with us for a long time. And I think over the last 4 months we have seen in relation to public services that do not meet the needs and the demands of the populace, and that has shown the fault lines in the last 4 months. And when we talk about pent-up demand in relation to economical demand, I think there's going to be huge pent-up demand for mental health services, and that demand, can that be met with the particular resources that mental health services have at the moment? So that's one question. And the second question is in relation to the Mental Health Commission, in relation to their submission. Part of it, they say that 114 residencies which are unregulated, so these are staffed community residency, can they give the definition of why they're unregulated? And because alarm bells kind of ring when you see unregulated, because if it's unregulated, who is regulating these services, particularly in this extremely challenging time for most people? So that's one question, and the other question is the substantial question: can mental health service meet the demand that it's inevitable that's going to happen because of the public health emergency we're living in?
Deputy, if I can answer your first question in terms of can demand be met, I think it's going to be a struggle. It was a struggle before COVID. It'll continue to be a struggle now. I think what's already been mentioned and commented on this morning is the importance of further investment in mental health in terms of the overall health budget, and that would be hugely welcomed. I think it's really important in that we look at the mental health budget in terms of a system of care, and looking at the areas of prevention and early intervention where Jigsaw focused on, and right up through to longer term and tertiary care. And I think it's having appropriate targets and supports at each of the different levels. It's hugely important. I think Ireland as a nation have embraced the idea of prevention and the idea of early intervention around COVID-19, so people understand those concepts very, very well. I think it's hugely important then to promote the concepts of early intervention around mental health, and as my colleagues have mentioned earlier on, the importance of mental health problems being identified and understood and arising due to COVID, but also getting the important supports for those as soon as possible. And I think the level of investment needs not just to be in the traditional mental health services and in the CAMS and the AMS teams, but looking at the wider supports and the broader psychosocial model of mental health.
It's particularly important that we recognise that the mental health services are a particular component of a service right across a whole population need. The profile of needs can be quite different. If you take, for example, young people, a CAMS service is designed for 2% of the population with a very extreme level of need. The question is what's before that. And I think similarly in the mental health space, in terms of we're increasingly seeing a movement towards promoting positive mental health, and indeed even a public health model even now begin to emerge with urban planning and how people live their lives and where they live their lives. So I think there's been many, many lessons here, and I think we have seen an extraordinary community bond and solidarity. but it also has shone a spotlight in terms of people sometimes we're most dependent on, in terms of their terms and conditions, their employment, their precarious work. These need to be addressed, and we're at a reset moment, and before we repack the boot of the car, let's be sure we're putting things in there that we really want in our community, and these are huge decisions that we have an opportunity to reflect on and to revisit. In terms of the how we invest in our mental health services, it's really important when it comes to, for example, promoting positive mental health, that we do this in an evidence-based way. We've worked with, for example, NUIG in Galway with Professor Margaret Barry, who's a world expert in this area, and developed a new Level 9 programme with 25 graduates coming out just this year. So it means that we're much better informed in terms of what works, what's effective, what's acceptable to communities, and strategies and life approaches that people can take into their own lives to protect their own mental health and that of their family members and people in their community. You mentioned also in terms of unregulated residential settings. And again, this is something of not quite a legacy from our past, but you have to remember in 1950, Ireland held the world record for psychiatric hospitalisation. So almost 1% of the Irish population lived in what were then large mental hospitals. And as people moved back to their communities and were received well back to their communities, often with the support of volunteers and with staff members, large numbers of community houses were established. And sometimes these were quite congregated settings, sometimes not ideally or purpose built. Oftentimes convents, old nursing homes, small hotels were taken on for this function. So we still see the last embers of that. And unfortunately, as we've seen the tragedy in the Marlborough Centre in Portlaoise, where 8 people who lived there passed away as a result of COVID, this has been a hugely traumatic effect for their families and indeed for the staff members who made valiant efforts to protect that group. So just the physical infrastructure didn't lend itself to that. And it's really difficult for someone to live a dignified, independent life where they don't have their own accommodation, they don't have their own space, and where they're sharing, sometimes even sharing bedrooms with an unrelated adult. We can do better in 2020. We've made big progress, but we need to finish that task to make sure that everybody has good quality accommodation, can live in their own space and make their own decisions. And that whole message around recovery and stepping back into a full life within the community is absolutely critical to what we do across the mental health sector.
Mr. Rogan, and thank you, Deputy Kenny.